Okay, so my name's Wendy Burke. I'm actually from the Iman traditional owner group, and on my dad's side, and Wuchopperen on my mum's side. So dad's is around the Strait Basin down that way, out west, and mum's is Wuchopperen area, around that area. So I'm Director of Health Services here at Wuchopperen Health Services, and I'm responsible to look after clinic operations.
I'm Rachael Ham. I'm born and raised in Cairns, and I'm an Wuchopperen woman and also Western Yalanji, both in North Queensland. One Wuchopperen people are from out near Georgetown Mount Surprise, southwest of Cairns, and then Western Yalanji is northwest of Cairns, up near Laura way. I'm the Deputy CEO here at Wuchopperen. Work very closely with Auntie Wendy. I'm learning a lot from Auntie Wendy, and I've been here since December last year, only 5 months. I think one of the things that I wanted to share was about our COVID vaccination clinic. It's something that's obviously been ramping up in the last few months. And we've been really successful, I guess, at getting our health workers through the training. So both the Cunningham training modules and also the Commonwealth modules. We've got 10 health workers that have completed all of those trainings, which means for us, we've got access to 10 people who are able to help vaccinate our mob here, as well as our nurses and our enrolled nurses. So we got some feedback from Queensland Health earlier today to say that we're one of the only ACHOs that are using our health workers at the moment in that vaccination space. So something I'm pretty proud of.
Yeah, and I think it ties in with the overall Wuchopperen health worker-led model of care, and that's what we're really promoting as a community control Aboriginal and Torres Strait Islander community control health service. We want to empower our health workers to take the front line and be the lead. So within our structures we have health worker coordinators who are responsible to manage the day-to-day operations of each clinic. But through that program we got a partnership, and what it does is it gives us as a community control organisation opportunity to upskill our health workers for hearing health things. It trains them up, because Kenny Burke is our lead health worker that runs that program. He looks after all the schools in Cairns, or not all, there's how many? I can't remember. Anyway,
I think
a number of
there's
schools
six or seven
in Cairns, and then because we have a clinic out at Edmonton, he also does a clinic out at Edmonton as part of his service. He can upskill people, but I think, he's more confident if he's got the happy people here to support, I suppose for his competencies to be on track to make sure things.
Yeah.
So that's one. Then we got another female health worker, Linny Merger. She works with breast cream, making sure that our screening is done every year. So through our programs, we've got women's, children, maternal health is one of them. So Lynn's the health worker over there, and she looks after basically antenatal breast screening. Goes with women's health, all those sorts of things.
Women's business.
Yeah, so for our clinics, I suppose, just to break it down a bit for you, where the health workers are, we've got an outreach team that generally looked after STI clients, but we've also combined that with general chronic disease, just doing health checks, but not necessarily here on site at the community hub, where a doctor, a nurse and a health worker go out and work together as a team to facilitate client care.
I think, so there's some examples of the work that happens in the clinics, and then out in the community we've got new positions, say the community connectors.
Yeah.
It's something that's only started in the last few months, and they're about going out to see our mob in their homes, and they're trying to build easier referral pathways for people who need access for the NDIS in and around disability support services. So that's one that's been it's quite new, and we're building up our reputation in that space, or getting people to know that we've got that service, and slowly building our client base in that space.
I suppose we do struggle a bit because of resourcing, and we try to meet the needs of our community in the best way we can, and we try to use our Aboriginal and Torres Strait Islander staff to do that in the first instance. And I think access is one of our key things, so we try to make that happen, whether it's through home visits, which some of our clinics do go out and do home visiting and check on people that way. We also have the integrated team care program and the community home support program. So we've got our own workers that go out and do support work with those families that can't manage totally on their own. Yeah, so whilst we talk about health workers, it's still about a team approach, and we try to look holistically at everything we try to deliver.